Is your dog limping on her front leg? She might have shoulder arthritis. In this edition of Veterinary Secrets, I'm going to be showing you the top 5 remedies for dog shoulder arthritis. Here we are I'm at my brother's farm, and we're here with Jenny, who is a 12-year-old Border Collie. Is that right, you guys? She's 12. She's been limping, and it looks like she's got some shoulder arthritis. So what I first want to show you is just how you could tell if your own dog has shoulder arthritis. We're gonna walk her a little bit. You can just see how she walks, and that may help you make that diagnosis of your dog having that. Then I'm discuss some of the pretty 5 quick and easy home remedies you can consider using. So first, let's get her walking and see if you can see her. Good girl, Jeannie, come on. And this is Snowball. You guys might see her over here on one side. Snowball's a cat. She's been in one of the previous videos, and she's very friendly. Good girl, Jeannie, come on, let's go. Let's take you for a little walk. Good girl. Oh, is she out of the video now? Good girl, come on. Good girl, let's go. Oh, good girl. Good girl. So what she's been doing is she's put a little bit more force when you have to watch her walk in the front leg. The one veterinary rule, they say you're going down on the sound leg. So she puts more force. You can see it's on her front leg. She puts more force on her left leg, so that's her good leg. So it's her right leg, which is the sore one. So it looks like she's got shoulder arthritis in the right leg. A couple other things you're gonna see. It's obviously, she's favoring her front, maybe a little bit more difficult getting up with her front leg. But as well too, I'm now just going to go and get a close-up. We're going to palpate her and just see if that is a bit uncomfortable. And that's what you want to do with your own dog too. So the first thing, if you're going to examine your dog, you just want to gently, support the shoulder, and I'm going from her elbow. I'm just flexing and extending it, just really gently, just seeing if she's okay with that range of motion. And if she was going to come into the veterinary practice, I would go a little bit further till she was seemingly uncomfortable. Good girl, and she's such a good dog. She's going to let me. Oh, you're a good girl. She only resists really when I go a little bit further out. So she's more interested in eating the meat than she is in me examining her. As well too, when you palpate her leg, especially up here in her shoulder, I can just easily feel all the bones. So the end of this big bone here called the scapula, it sticks out really well. And the other end of this other big bone here is called the top part of the humerus. It's really easy to palpate. So what's happened is she's lost a whole lot of the muscle mass. Good girl, you. So it's pretty consistent with the dog that's got shoulder arthritis. So the first thing I would have you guys consider using is a good quality dog supplement that's going to include glucosamine, chondroitin, MSM, ideally along with a 95% curcumin and an essential fatty acid. So some of the things here, this for instance here is just the 95% curcumin, which can work really well if you're trying to naturally treat a dog that has arthritis, and specifically shoulder arthritis. In my supplement, Ultimate Canine Advanced Health Formula, it has all of those ingredients in levels that are considered effective for a dog would have shoulder arthritis. So that would be the first thing I'd suggest, the Ultimate Canine Advanced Health Formula. The next thing is something that all of you are likely going to have in your bathroom, in your medicine cabinet, and it's going to be aspirin. And this is something that is not meant for long-term treatment, it's meant for short-term. So when you've got a big flare-up. So Ginny here, she's a working dog. She's a Border Collie. She's herding cows, she's herding sheep. And she's gonna really overuse that leg and come in really lame. And if that's the case, initially you wanna give her something that's gonna be really good for immediate pain control. And short-term, aspirin is probably all the safest things over-the-counter sort of conventional drug that you can use. When we're looking at aspirin doses, we're looking at sort of one 325 milligram tablet per 40 pounds of body weight, and it'd be given twice daily. So one like this, and for something like her, you could treat her for 2 to 3 days. That would be fine. You just want to make sure, one, that she's given it on a full stomach, and two, she isn't on any other anti-inflammatory or on something else like prednisone. third one I want to discuss is using acupressure. I mean, it's related to acupuncture in terms of we're like focusing on the certain acupuncture points, but it's something you guys are able to do at home. So what we're doing is we're focusing on a couple of 2 or 3 key points, which I think are pretty easy to find, and they may not work. I know with my last dog, Lewis, he responded really well to acupressure. He had a fair amount of degenerative disc disease. He had a certain area of his spine that was starting to fuse together. Worked really well for him. Other dogs, they don't respond. But I do think it's something you should consider and it's worth trying, especially if you've got a dog with shoulder arthritis. It can be pretty difficult to treat. So we're just going to get the camera a little bit closer here, and I'm going to show you exactly where those acupressure points are and how to do it. So this is Jeannie's shoulder joint here. So this big bone here is the humerus. The one just above it is called the scapula. So first of all, you need to find it. So I want you to grab your dog's elbow, move the joint back and forth. And so you're moving the humerus forward and backwards. And right where my finger is here, that's right on top of the shoulder joint. So right here at the front point of the shoulder joint, you're going to feel this point. It's called the point of the acromion. That's the very end of the scapula. And right in front of it, there's a depression. And that's one key acupressure point. It's called the Li14 point. So you can hold that right in here. You want to indent the skin for about 30 to 60 seconds. Do that twice a day. Do that for a week. It's not hurting her, but enough that it could affect that key point to see if that's beneficial. Secondary, there's an acupressure point just in behind that. So we're going sort of in front of the shoulder, then just in behind the shoulder. Once again, it's where the humerus is meeting here, the scapula. And you can use your thumb, your forefinger. You're going to put pressure once again on that point. Oh, go grow. It's a little bit uncomfortable. You don't want it to be uncomfortable. You're going to hold that for 30 to 60 seconds. Do that twice a day. Do that for a week. See if that's helping your dog or not. The fourth remedy I want to encourage you guys to use is just basic massage. So when you're looking at your dog's shoulder and their shoulder joint itself, they've got these big muscles of their neck, which are running along here, which are attaching down, inserting along sort of the scapula, attaching right into here, the edge of the shoulder joint. You've got some of these other big muscles. You've got the trapezius, you've got this big muscle here, the deltoid, part of the biceps, all along in front and behind the humerus itself. So all those muscles in arthritis are becoming constricted. So what happens is your dog loses its range of motion. They've got these really tight muscles, restricts the range of motion, and that can be really painful unto itself. So the more motion you can keep in your dog's shoulder, the less painful they're going to be. So the first thing is just get used to your dog. They call it passive range of motion. Like you were just supporting the shoulder, just flexing and extending it. You just want to making sure that they're moving it. Every time you move it, you produce a bit of joint fluid, makes it less painful. They say you can just go for 20 or 30 flexing and extending motions, twice a day. Do it for a week. A lot of dogs respond really well to it. Secondly, if you're going to massage those muscles, even if once a day at night, first you're just using your palm of your hand, just working it along the shoulder. So just above the shoulder joint, just below the shoulder joint, on both sides, so in front of the humerus, in front of the scapula, all these big muscles of the neck, especially with the palm of your hand. So you're just loosening them up. And then secondarily, you can use your thumb, your forefingers, and you can start right on the joint itself. And as you're palpating these circular motions, see if you can feel any little knots. They can be above the big muscles, in front or behind the shoulder. And if you feel one, like Ginny has one right here, right in front of her shoulder joint, you're going to find that little point or that knot, put moderate pressure on it, hold it for 20 to 30 seconds, and then release. Okay, so the last remedy I want to discuss with you guys is using CBD oil. And it's one that I used with my last dog, Lewis. He had mouth cancer, who responded really well to it. It's not going to be available to all of you, but most of you, if you're using CBD. Once again, it can be expensive, so it's not necessarily something you're going to use long term. It can work really well for these inflammatory flare-ups. It can be also considered, alternative to some of the anti-inflammatory drugs. So if you're able to get it, the main thing I'm looking at is CBD oil. It doesn't need to have any THC at all. We're looking at therapeutic doses for our dogs. We're looking at 1 milligram for 10 pounds of body weight daily. So she is about 50 pounds. She needs about 5 milligrams a day. It could be given up to twice a day. Most guys, once a day can be enough. You really have to sort of play around and see if you're helping your dog or not. So here is this Cbd oil here. It's got 5 milligrams per serving. So it's 5 milligrams and about 20 drops. So we're actually gonna give some to her now and see what she thinks about it, see if it helps her. So Jeannie, I have a secret little surprise for you. Good girl. Yeah, we're hoping you're, ugh. No. Good girl, you ate it. Most of it's in a coconut oil base. So most guys are gonna take it pretty well. We'll give her the 1-day dose and see if she's feeling any better tomorrow. Thanks so much, you guys, for watching this edition of Energy Secrets. I also want to thank my 2 nephews for helping me do the filming. We have like Logan.
Hello.
And Luke.
Hey.
And Jeannie. That's awesome.